And I'm so excited to welcome you to Medicare 101. Medicare is a sacred commitment that we've made to our nation's seniors. I know firsthand how vital Medicare is because my mom relies on it. When she's had urgent health care needs, Medicare has been there for her, and I'm committed to making sure that Medicare is there for you and every other senior Hoosier. Just last year, the House of Representatives passed my legislation, the Bipartisan Beneficiary Enrollment Notification and Eligibility Simplification Act, to protect seniors from unnecessary late enrollment penalties, gaps in coverage, and unexpected healthcare bills. It's a good step forward, and I'm continuing to advance bipartisan reforms to safeguard your access to Medicare for years to come. I also believe that keeping our promises to Hoosiers is super important, and information and assistance that you need to secure the benefits you deserve. As we approach this year's open enrollment, which begins October 15th and runs through December 7th, it's important that you understand the basics of the Medicare program and have a chance to ask questions and get answers from experts. That's why we have a caseworker from my staff, Jan Faker from our Rochester office, as well as a Medicare specialist from Indiana State Health Insurance Assistant Program. They're here to share their knowledge, answer your questions, and help you understand what you need to know about Medicare. I want you to know that my office stands ready to assist you in any way we can. So please don't hesitate to reach out. I'm grateful for the opportunity to serve you, and I hope to see you out in our community soon. Now I'd like to turn this over to Jan to start Medicare 101.
Well, hello, and thank you for your interest in Medicare 101. I am Jan Faker. I'm Jackie's constituent liaison, and I will be moderating Medicare 101 today. I'm delighted to welcome my co-presenter. She's down there, Megan Rogers. Hello, Megan. Megan is with the State Health Insurance Program. That's like SHIP is what it's called, like a big boat, SHIP. And she comes to us loaded with experience. Before her time at SHIP, she's been with SHIP for 9 years. She was with the Area Agency on Aging for 10 years. Again, my name is Jan Faker, and I'm the Senior Constituent Liaison for Jackie Belorski, and I've been with her for 7 years. Before that, I've served a total of 27 years with 3 different members of Congress, always specializing in healthcare, Medicare, and Social Security. We've been doing these Medicare 101s in partnership with SHIP for many, many years, all throughout Jackie's Indiana district. And I always like to begin them with this statement. Medicare is like a newborn baby. It arrives with no instructions. And that's why we're passionate about bringing these Medicare 101s to you. And this year, as in 2020, it's virtual. You can watch it on Zoom or Facebook, and you can watch it in your sweatpants and a cup of coffee. And guess what? If you want to watch it again, it's being recorded and it will be on Jackie's Facebook page, and you can watch it again, or you can share it with a family member, or maybe neighbor Mabel who's telling you that she doesn't understand Medicare. Please feel free to do that. Now, one thing I wanted to mention, that it's recorded and you can share it, and we will have a list at the end of this presentation of all the emails, phone numbers, contact numbers, the great resources that we're going to mention today. Next slide, please. So what will we cover today? I'll be talking about what's new in 2022, and then Megan Rogers from SHIP will be talking about what is Medicare, who is eligible, when do I enroll, how do I enroll, Medicare Parts A and B, and MEDIGAPS and supplements. And then I will teach Medicare Part D drug plans. And then Megan is going to then talk about Medicare Part C Advantage plans, and then we'll wrap it up and we will have questions. Now, a note about those questions. You can submit questions by going on the comment section of the Facebook page, or you can, if you're on Zoom, there is a little chat button at the bottom. You can hit that and type in your question. And we do have some questions that were already submitted. We will be answering questions at the end of the presentation. Now, from past history, some of you are already on Medicare, And some of you are aging into Medicare. That's what we call it in the business. I don't particularly like that term, but it is what it is, aging into Medicare. And you want to learn about Medicare. I'm finding that new beneficiaries are very intent upon understanding the program. I think there was a generation before us that just let those Medicare benefits come and whatever happens, happen, but it's not that way anymore. Some of you may be caregivers for your parents or your grandparents, and you all of a sudden are in charge of their health, managing their health care, and you need to understand Medicare. Regardless, we know that all of you want to understand the program better so that you can make Medicare choices that are best for you, not for your spouse, not for your mother, not for your neighbor, so that you can make Medicare choices. I always say, knowledge in Medicare is empowerment. We want you to feel confident about your Medicare choices, and the choices you make at 65, many of them will remain with you until you die. So anyway, we promise to make Medicare very simple today, and we'll have a little fun in the process. And oh, did I mention there might be a quiz or two along the way? Well, there is. So let's get going. Last week, or last month, I should say, I received my Medicare Annual 2022 handbook. I like to call it the Medicare Bible, although not written by the hand of God. No, it's written by some experts in the Medicare business. But let's be honest. How many of us read all 127 pages? Probably not too many of us. So Megan and I are going to condense this down, and we are going to give you the important things that we think you need to know to be knowledgeable about Medicare. And by the way, almost everything that we mentioned today and most of the charts are from the Medicare Annual 2022. That's why we do these. We want to condense that 127 pages down, so that you have the information that we feel is important for you to know. So what else is new in 2022? Well, it's not really new. Next slide, please. It's not really new. Back in 2018, Medicare ended this 3-year program to distribute and make new Medicare cards. As you know, the previous Medicare cards had Social Security numbers on them. What a terrible security risk. I would tell my constituents and my folks when I would be out speaking, do not carry your Medicare card. It has your Social Security number on it. So in 2018 and beyond, if you're new to Medicare, you already have this. You have a Medicare card that has your unique identifying number. It has letters and it has numbers. It also has on it the effective date of your Part A and the effective date of your Part B. Remember, guard your Medicare card like a credit card. Don't leave it lying around. And no one should really need your Medicare number but your healthcare providers, hospital, doctors, or your pharmacists. Do not give your Medicare number out to anyone who is calling you, because neither Medicare nor Social Security will call or visit you. Don't be scammed. Now, again, we'll be referencing resources and contact information and websites in today's presentation, and they will all be available on the last slide of the presentation. And I also have made a copy of that with all the email addresses, websites, phone numbers that you can download, in addition to other downloads that we referenced today. Next slide, please. So I was going to say to you, as of 48 hours ago, we don't know the COLA, but if you have been listening to news in the past day, you know that Social Security yesterday released the cost of living increase. I always get asked this, it's not really Medicare related, but we all take Social Security and it's important to us. Yesterday, they released that the cost of living increase, which is based on the consumer price index, that's inflation, the cost of products and goods and services. And it was based on the last quarter ending in September. It was announced that the COLA, the cost of living increase for Medicare beneficiaries, will be 5.9%. That is the highest COLA in 39 years. Why? It's really a no-brainer. We're living in high inflation in 2021. It is based on inflation. This COLA is not something that is legislated or that Congress thinks up or the president or Social Security. It is based on data, the data from the Consumer Price Index. So then the next logical question is, what will my Medicare Part B premium be in 2022? Well, we don't know yet. It'll be released later this month. I always like to say Social Security giveth and Medicare sometimes can take away. We are hearing, Megan and I have been sort of discussing back and forth. It looks as though the Medicare premium is going to be historically raised. It's going to be an historic increase. Again, it is not based on a whim of some congressional member or the White House. It is actually based on the actual cost of Medicare services in 1 year divided by the number of beneficiaries. And that Part B premium is 25% to you and 75% Medicare pays. It is at the actual cost. So as costs go up, so does your Medicare Part B premium. It is currently $148.50. Megan and I are hearing that it could go up as much as $10 a month. We don't know. We'll find out later in this month, the Medicare Part B premium. Also new, and it's not, again, Medicare, but Social Security has just come out with a new look to their Social Security statement. This is that earnings statement that you used to get in the mail, and it was 4 pages long. It's now 2 pages long. It's easier to read. It's easier to understand. It has your earnings record on it, and it has what your Social Security benefits would be when you're going to retire at a certain time. So it's a great retirement planning tool, and it is accessible and available on your Social Security online account. Remember how they used to mail those once a year? They do it once a year, but they used to mail it, I think, 3 or 4 times a year. But to cut costs, it is now mostly accessible on your Social Security online account. And we'll talk to you a little bit about how to start that. And now, a word about Medicare Annual Enrollment Period. Or why is my mailbox exploding? And why are all the TV ads suddenly these aging celebrities trying to sell me a Medicare product? And how does Joe Namath and Joe Montana and Pat Boone know that I'm 65? It's a mystery to me. Oh, and yes, my birthday was last week, and I have to show you this. I got about 2 cards, but look what I got in the mail. All Medicare marketing. You'll like this one. This one is addressed to my mother-in-law, Veronica. She's been deceased for 20 years. She got invited to a special Medicare event. So here is my best advice. Just ignore it all. Throw it away. Megan and I are going to give you the information that you need to buy the plan that is best for you. So what can you do in the Medicare Annual Enrollment? It starts tomorrow, October 15th, and runs through December 7th, which we all know is Pearl Harbor Day. Megan tells me October 15th is National Grouch Day. I didn't know that, but maybe we'll all be grouchy tomorrow. But tomorrow is the start of Medicare Annual Enrollment. What can you do beginning tomorrow? You can join a new Medicare Advantage plan. You can join or switch Part D prescription drug plans. You can switch from original Medicare to Advantage, or switch from Advantage to original Medicare with or without a Part D plan. And there are some issues you need to know. You just can't do that. And there's some things that Megan will explain about what you can and cannot do. And all of these changes that you make in the annual enrollment period are effective January 1st, 2020. And one thing that I want to add, this word of caution. We've noticed in our office that almost all federal agencies are running with a backlog or behind. During the pandemic, they were either closed or working from home, and there are backlogs. There are backlogs if you tried to get a passport this summer. There are backlogs of visas. And I'm also hearing that there is a backlog of Medicare cards. So I always used to say your initial enrollment period, and we'll talk about this, is 3 months before your 65th birthday, the month of, and 3 months after. And I said, don't worry, you can apply 2 months before. I don't say that this year. you need to apply at the first moment that you can, which is 3 months before your 65th birthday. There is a delay in getting these Medicare cards. Now, you want to have your Medicare card by the time that you're 65, so enroll as soon as you quickly can. Now, your Medicare will be effective on your 65th, the month of your 65th birthday, but you might not get that card. So enroll early. I think that's it, Megan. I think we'll turn it over now. Oh, first of all, so let's learn about Medicare, and let's bring in Megan Rogers, our expert from SHIP, the State Health Insurance Program. And one thing I wanted to say, one thing that I think is especially advantageous for today is that SHIP cannot sell an insurance product. They don't sell anything. They can't market anything. Neither can our office. What we do is give you free, excellent expert advice so that you can make your own decision. So Megan, take it away.
Thank you, Jan. What a great update on the changes for 2022 and what the presentation is going to provide to everyone. I'm going to take it a step back and talk about what you need to know about the basics of Medicare, get us started on what the different parts of Medicare are, either for individuals that are, as Jan said, aging into Medicare or have been on it for a while and would like a refresher. So first, we're going to start with who is eligible for Medicare. So first off, you do have to be a U.S. citizen or a legal resident for at least 5 consecutive years. That's the first requirement for Medicare. And then once you've met that requirement, Medicare is primarily for 3 groups of individuals. If you are 65 or older, you become eligible for Medicare. If you are under the age of 65 and you have been receiving a Social Security disability check for at least 24 months, then on the 25th month, you get Medicare. It does not matter how old you are. This is why sometimes we have babies on Medicare or children or younger adults. And then if you are under this age of 65 and you've been diagnosed with ALS, Lou Gehrig's disease. And then the third category is any age with a diagnosis of end-stage renal disease. Those are the 3 groups of individuals that are eligible for Medicare. Next slide, please. So when do I want to sign up for Medicare? So as Jan said, because of the delays with the pandemic and even the mail, we do want to make sure that we're aware of when we should be enrolling and do it as soon as possible. This is not something that you should put off for a very long time, or there could be consequences for those delays. And we'll be talking about those consequences throughout the training. So when you are first eligible for Medicare, you have an initial enrollment period. Medicare is made up of a lot of enrollment periods, and your first one is your initial. So this is 7 months. So 3 months before your birthday, the month of your birth, and 3 months after. And as long as you do enroll in time, that's the 3 months before your birth month, then your Medicare is going to start on the first of the month. My mom, her birthday's on Christmas. She's a Christmas baby. And her Medicare does not start on December 25th. It started on December 1st. So that's something to keep in mind too. It'll start on the first of the month and not actually on your birthday. And so if, like I said, if you enroll before you're turning 65, so in those 3 months before, then your coverage is going to start on the first day of your birthday month. If you delay and you do not call Social Security till the month of your birthday or sometime 3 months after your birthday, then your Medicare start date will be delayed. And Social Security will determine when that enrollment date will be. So that's something you discuss with Social Security. Next slide, please. So there are 2 categories on enrolling. Some individuals are automatically enrolled in Medicare, and they do not have to call Social Security to get signed up. So if you were 65 and you're getting some form of Social Security income a month, if you are under 65 and you're getting that Social Security disability check, or you're under 65 and have ALS and have a Social Security disability check as well, then you're automatically going to be enrolled. My mother has Social Security income, and she was automatically enrolled. We got her card bright and early in the end of August. So that was about 3.5 months before her Medicare started. So you want to start looking for that envelope from the Social Security office. It will have the Social Security name on the envelope and their logo. So you can watch for that when your time comes, if you're on Social Security before the age of 65 or disability. Next slide, please. So what happens if you are not getting Social Security income? You will not be automatically enrolled in Medicare. You need to contact the Social Security Administration, ideally 3 months before your 65th birthday or the 25th month of disability, though those individuals would get a Social Security check. So those you don't have to worry about. But if you're not getting Social Security and you are turning 65, make sure you're calling it 3 months before. That way you can get a hold of someone at Social Security, you can get your paperwork in, and you can get that card in time before your 65th birthday. You can call, you can go online at the socialsecurity.gov website. Social Security offices are still open during the pandemic. You can still make appointments to go in and see someone. Even though the door is locked for you to just walk in, you can call Social Security, you can enroll over the phone, or you can schedule an appointment to go in to the Social Security office at this point. And then once you get enrolled, they will send you your red, white, and blue Medicare card. A lot of people don't realize that it's a paper card. Some people think that that's a temporary card, and I have had some beneficiaries throw those away because they're waiting for their plastic card. No, the card that you get from Social Security, red, white, and blue and paper, is your card. That is the card that you want to keep. That is the card that you want to make sure you turn over to your doctors once you're eligible and on Medicare, so they can start processing that as your insurance. And that's what you're going to want to keep for your medical appointments. Next slide, please. So we are going to start diving into our different parts of Medicare. So we have, I call Medicare our alphabet insurance, because we have everything is defined by the alphabet. Our basic parts of Medicare, we have Part A, which is our inpatient hospital coverage. We have Part B, which is our medical, so anything outpatient. And these two parts make up what is known as original Medicare. And then we have some add-on parts of Medicare. We have our Part C, which is our Advantage plan, which is a different way to handle your Medicare and bundle your Medicare into one plan, which we'll talk more about later today. And then we have Part D, and that's our prescription drug coverage, which Jan is going to fill us in a little bit on that. The other part that we'll talk about today, which actually is not defined by the alphabet, is called a MEDIGAP. It's a supplement, and we're going to learn how that assists with our Part A and our Part B original Medicare to help reduce some of our out-of-pocket expenses. Next slide, please. But before we get into the details of these different parts of Medicare, we're going to define some of the terms that we talk about. There's a lot of insurance terms, of course, with Medicare because it is insurance. So our first definition is premium. So some of our A and B and our Advantage plans and our drug coverage, they have premiums. And that's what you need to pay every month to keep that plan. If you stop paying that premium, you will most likely lose that plan. We then have an out-of-pocket maximum, And that is what you're going to pay out of pocket yourself total for that year. If you meet that max out of pocket, some people do, some people don't, but if you meet that max out of pocket maximum, then your insurance company is going to pay the rest of that. This does not include your premium. At least for Medicare purposes, it does not include your co-pays. It's going to be your medical expenses, co-pays for doctors, tests, lab work, any of those co-pays. Next slide, please. We then have our deductible, which some of the parts of Medicare have and some don't, which we'll get into shortly. This is what you need to pay at the beginning of the year or your benefit period before the plan will pick up any of the costs and you start paying those co-pays. We then have our co-insurance, and for Part B purposes, Medicare pays 80% and we would pay 20% as the beneficiary. And then the copay fits into that equation as well, where we're going to pay 20%, Medicare pays 80%, unless we're on an Advantage plan. And then we're going to pay a set dollar amount that insurance plan has determined. And of course, we're going to get into the specific details of all of these definitions very shortly. Next slide, please. So Part A, this is our hospital. So think anything inpatient. If you're inpatient somewhere, then your Medicare is going to be, your Part A is what is going to pay for it. So the primary inpatient on this one is your hospital. That's the one that you're probably going to use the most. So there is a deductible in 2021 of $1,484, and it's per benefit period. So the deductible on Part A is a little bit different than what we know commonly from insurance companies. Normally, the deductible is at the beginning of the year. Once you pay that, you're good to go. In this case with Part A, they look at benefit periods. So if you go into the hospital in January, your benefit period starts. You go to the hospital, you then are there maybe 2 or 3 weeks, you go home. You have to be out of the hospital and in the community for 60 days. Once you are out of the hospital for 60 days and back in the community, you would switch over to a new benefit period. And that means you pay a new deductible next time you go to the hospital of the $1,484. Now, if you go to the hospital in January, you then have to go to a nursing home. You're still inpatient. And once you're still in the same benefit period, because you have not gone home yet. You've gone from one inpatient to another inpatient. Then you go home, let's say you go home in March. Well, you have a fall when you get home. So you go back to the hospital, you're back inpatient, you have to go back to the nursing home for some more rehab. You have not been home for 60 days. You are still in the same benefit period, which means you do not have to pay that deductible. But because you're in the same benefit period, you're still using the same pot of days that you're allowed in each benefit period for being in the hospital or the nursing home. So if you have multiple benefit periods, the pro can be that you do not have to pay another deductible. The con can be that you've lost some days, potentially some coverage days. You are using up your max 90 days in the hospital, your max 100 days in the nursing home, and you may need more coverage than that. Now, if you have had gaps and you're in multiple benefit periods, then the pro can be that you're going to have more days available to you when you go to the hospital or the nursing home for coverage, the con can be that you have that deductible to pay each time you go in for a new benefit period. So there's pros and cons there. I like to make sure people understand that Part A has the benefit periods, because that's a little bit different way of looking at your deductible, and most insurances don't have that. And the Part A is the only form of Medicare that has the benefit periods. So for hospital coverage days per benefit period, you're going to pay $0 for the first 60 days. If you're in there from 61 to 90 days, it's $352 a day. And if you happen to have to be in the hospital past 90 days, from 91 to 150, you're going to pay $704 per day. Nursing home, so this is for rehab. Medicare does not do any long-term coverage in a nursing home, so it's going to be short-term. You have generally per benefit period up to 100 days that you can use. Now, you still have to qualify for that. You still have to be approved for the amount of time you're in a nursing home. So just because you're approved to go to a nursing home does not mean you're going to be in there 100 days. It's going to depend on what your condition is, how you're doing in rehab, and if you're able to go home or not. You do have to have a 3-day inpatient hospital admission, also called as 2 midnights, to have your Medicare allow you to go to a nursing home and for it to be covered under Medicare. So that's important to know. You want to make sure when you're in the hospital that you are listed inpatient and not outpatient or observation status. You can be upstairs on the 12th floor in a room with room service, a private room, and you were observation status or outpatient. So it's important to know if you're listed as inpatient or outpatient. The hospital is supposed to provide you documentation showing if you're inpatient or outpatient, but sometimes if you're not feeling well or they come in so quick, you don't know who's coming in, you don't know if it's an aide or a nurse or a doctor or the housekeeper, and they're putting stuff on your nightstand, you're not sure what you've been provided. It's okay to ask to make sure that you know what is going on. But when you get to a nursing home, you're not going to pay anything for the first 20 days. If you're still in the nursing home after day 20, from day 21 to 100, you will pay $185.50 per day. Quick note, there is a new regulation out there due to the pandemic that your doctor may be able to get you over to a nursing home without having a hospital stay. If you're medically stable and you can be treated medically at the nursing home without being taken to the hospital or the ER, Medicare is allowing for that exception because of COVID. So if the hospital is full, the doctors in the hospitals don't want to expose individuals to COVID, either by you being at the hospital or exposing you to COVID with you being at the hospital. So there is that exception. You can speak to the nursing home you'd like to go to and or your doctor about how to get that process going. And then Part A also covers blood, home health, and hospice. Most of the individuals on Medicare are not going to pay anything for their premium. Now, there is a small amount of individuals who do not have enough work credits throughout their life. That's 40 credits, so 10 years of working, not consecutive. If you have less than those 40 quarters, then you will pay a premium. But as long as you have 40 quarters, then you do not have to pay a premium because you paid for it throughout all your working life in the FICA tax. Next slide, please. All right, so now we're going to talk about Part B, as in boy. So this is our medical. This is anything outpatient. Part A was inpatient, Part B is outpatient. So this is when you go to the doctor, outpatient hospital services. So if you're having a procedure, an X-ray, a CT, an ultrasound, you're having an outpatient surgery, this is going to be covered under your Part B. Some home health is also covered under Part B. Your durable medical equipment, canes, walkers, grab bars, bedside commodes, wheelchairs, oxygen, diabetic supplies, they are all going to be covered under Part B. Your blood work, preventative services. Part B has a whole list of preventative services. We have our annual wellness visits, our screenings, shots and vaccines. So your flu shot, your pneumonia shot, even your COVID shot are all covered as a preventative screening under Part B. They have depression screenings, cancer screenings, substance abuse screenings, your colostomy exams, your mammograms are also listed as a preventative. This means you will not have a copay for these services. Now the Part B annual deductible actually in 2021 is $203. The 217, while I have not physically seen it yet, most likely is the new annual deductible for 2022. And then Part B has the equation of Part B is going to pay 80% and you're going to pay 20%. And we'll talk about when that equation changes if you have a supplement or you go with an advantage plan. Next slide, please. So unlike Part A, Part B does have a premium. And right now it's $148.50. And as Jan broke the news to you all, it is going to go up significantly in 2022 from what we have both heard. We have not seen the magic number yet. We have just heard some noise about it through the grapevine. So that official number should be coming out any day now. Usually it comes out end of October, maybe even early November. So be watching for that. And then there are some individuals that actually do pay more than the standard $148.50. That is if someone has a higher income. It's called the MAGI, the modified adjusted gross income. So if for an individual, if your MAGI is more than 91,000 and if you're a joint filer, if it's over 182,000, then you're probably going to pay more than the $148.50. It can go up to about $500 a month if your income is significantly higher. And I have worked with some individuals that do pay $500 or more a month for their premium. Now, when Social Security determines this, when they're looking at your income, they're going to look at your taxes from 2 years previous. And that's how they determine what your premium is going to be. So if you're new to Medicare in 2022, they're going to look at your taxes from 2020 to determine. So sometimes I hear from people, well, I got divorced or I lost my job or my income was so high in 2020 because I got a settlement or my mother passed away and left me all this money. If there is a change with your income, it no longer reflects what it was 2 years ago. You just call Social Security up and explain the situation and appeal the situation. They will adjust what your premium is based on the current situation. So there are options if things have changed in 2 years, because a lot of things can change in that amount of time. The other thing to be aware of with Part B and the Part B costs is penalties. So if you did not get Part B when you were first eligible, then you might have a penalty for delaying your enrollment. If you did not get Medicare during your initial enrollment period, and you did not have employer insurance, creditable employer insurance through you or your spouse's employer, then you may have to pay 10% for each 12-month period you did not have Part B. And that penalty lasts your entire time on Medicare. So please make sure that you're aware of all of the ins and outs. You know, if you do have employer insurance, if you don't have employer insurance, what are your options to you when you need to enroll before you make any official decision? Having all of the facts is extremely important with Medicare. And that's why Jan and I and Jackie Wolski's office offers this every year, because we want everyone to be informed before it's too late and a penalty happens. Next slide, please. All right, so this is a common question that I get quite a bit. Can I decline my Medicare Part B? You can. You do have some options here. I get a fair amount of people that call me and say, well, my Medicare is going to start in December and I'm still working. Well, then we've got some options. You don't necessarily need to take your Medicare. So if you are still actively working or your spouse is actively working, either one of you or both of you, and you have coverage through either your employer or your spouse's employer, and it's a large group employer health plan, then you can delay without penalty. Well, what is a large employer health plan? That is if the employer has 20 or more employees. Now, if you, because we're talking about Medicare for you, if you are disabled, and let's say you have insurance through your spouse's employer, because disability is at play, a large group employer health plan is actually determined by 100 or more employees. So getting Medicare because you're aging into it, because you're turning 65, the magic number is 20. Getting into Medicare because you have a disability, the magic number is 100. So those are important numbers to keep in mind. And if you can't remember them, you can call a SHIP counselor and we can remind you and support you through this. It's also important to know that it's not retirement health coverage. This has to be an active employer health plan. Be sure you know all of the facts before you outright decline your Part B, or you could be subject to a penalty. So you can call Medicare or Social Security, and they can walk you through the process as well. You can also call SHIP and we can walk you through the process. You can talk to your employer for evidence of coverage if you're working, and they will be able to tell you if it's a large group employer health plan or not. And then what happens is if you do decline your Part B, because you do have creditable large group employer health insurance, then when you retire or your spouse retires, you have 8 months to enroll in Part B with no penalty. Now, if you wait 9 months to enroll after retirement, unfortunately, you will get a penalty at that point. But as long as you have creditable health insurance and you enroll within the 8 months of retirement, you are good to go with no penalty. Next slide, please. So now we're going to talk about a supplement. A supplement is also called a MEDIGAP. And this is the type of Medicare that fills in the gaps of what your A and your B, your original Medicare, does not cover. So these plans can help pay for your out-of-pocket costs, your deductibles, your co-pays, and your coinsurance. It will not pay for your premium for your Part B or A if you have a premium for that. They are managed by private insurance companies. And the one thing that SHIP cannot help you with is we cannot sell you insurance. We can help you compare plans. we can provide education, we can help you enroll in a drug plan or an advantage plan because we're not selling you a plan. But because MEDIGAPS actually do potentially look at pre-existing conditions, and they're going to ask you 20,000 questions about your health, depending on when you get a Medigap plan. This is not something that we can sell to you. So you have two options. You can go to an insurance agent or an insurance broker. That is an option you have. Or you can sign up for one yourself. Now, all insurance agents are essentially biased. SHIP is unbiased because we're not associated with an insurance agent or insurance companies, but the insurance agents are assigned to insurance companies, and they will be biased, and they will cost, whether you have to pay them or then they're getting money from the insurance company. So sometimes I get questions from people, well, I want to work with someone who's unbiased. I want an unbiased insurance agent. And unfortunately, if they have an insurance license, they are not going to be unbiased. So this is something that everyone can do themselves. We have a website here that you can go through the Indiana Department of Health Insurance, and you can play around with this, and you can look at the different Medigap plans, which we'll look at in a second, you know, put in your age, if you smoke or not, in your zip code. And all of those plans are going to come up, and you're going to see how long they've been around, what their ratings are, their phone number, their address, and you can call them yourself and get enrolled. You can also come to a SHIP counselor for support. We can provide education. We can walk you through this website and do this with you. We can also sit in the room with you when you call the companies. We can't help you enroll or sell you the insurance, but we can be there to be an advocate and support you. Next slide, please. So this slide shows us all of the Medigap plans. Now, this is in the Medicare and You Bible that Jan talked to us about earlier. So you can refer to it. I know last year was page 72. It might be on page 76 this year, but I'm not positive. I saw that somewhere. Jan's kind of shaking her head there. So it's in the 70s somewhere. So it's a little small print here, but you can refer to your book. You can even Google these online, Medigap plans. And if you click on images in Google, you're going to get an image like this that you can look at. Now, again, we're back to the alphabet insurance. The Medigap plans, they talk about their separate plans and they define them with an alphabet letter. So a couple things that I want to note on this slide is C and F. Those actually are no longer available to new Medicare beneficiaries as of January 2020. Now, if you've had Medicare before that, even if you don't have a Medigap, even if you don't have C or F, even if you just have Part A that you enrolled in 5 years ago, but you did not get B yet because you're working, you still have Medicare. So as long as you had Medicare, then before 2020, then you are able to get a C or an F. Now, for those that are eligible for Medicare after that point, unfortunately, you can't get any of those. Those went away. But the next best is a Plan G. So some of the coverage, we'll look at a Plan G for this presentation. It will cover your Part A coinsurance. So if you're in the hospital for 61 days, you don't have to pay that copay every day. If you're in the nursing home more than 21 days, you do not have to pay that copay. It'll pay your Part B coinsurance. It's got some blood coverage, your hospice coverage, nursing facility coinsurance. It will cover your Part A deductible or deductibles if you have multiple benefit periods. The couple things that it will not cover is the Part B deductible. It will not cover the 203 or the 217 for next year. So that you'll be responsible for. G does have what is called Part B excess charges. Not most of the doctors in the Northwest region have this, but some specialty hospitals do, like Mayo Clinic or Riley's Hospital or Cleveland Clinic. Then some of those doctors, they bill Medicare, the max that they're allowed to, but they're allowed to bill the beneficiary an extra 15%. And Medicare is not going to pay for that. The beneficiary has to. But if you have a Medigap, then your Medigap plan G, will cover that. And then some of the plans, not all of them, will assist with foreign travel emergency coverage. Medicare A and B and Advantage plans normally do not have foreign travel coverage, but your Medigap does provide some foreign travel assistance if there's an emergency. And now I think, Jan, it's time for that quiz you talked about.
Well, at least the first quiz.
Okay.
And I wanted to say you are correct, Megan, that Medigap plan is on page 76 in your Medicare and You, but I
Awesome.
also have a copy of it. It's one of the handouts that you can download after the presentation today. I also have a copy of what's called from CMS, Centers for Medicare and Medicaid Services, that's it, 2021 Medicare costs. The reason I don't have 2022 costs is that we don't know what they are. They'll be coming out very soon. But this is great because it will give you, Megan talked about the MAGI. It gives you the income limits if you have that modified adjusted gross income where you have higher income and you're paying more. It has several pages of that. So this is a 3-page handout, among other handouts I'll mention that you can download, and we'll have that website, Jackie's website that we're using, actually most of you probably got on, we'll have that on that last slide as we go. It is time for quiz time. And I think your head is probably spinning at this point. So next slide, please. Let's do a quiz just so that we can keep up with where we are. First of all, when are you eligible for Medicare? I bet most of you can answer this. Answer, please. At age 65. You can enroll, you have that 7-month initial enrollment period. You can enroll 3 months before your 65th birthday, the month of, and 3 months after your 65th birthday. And again, as both Megan and I've said, if you want that card, your enrollment will be effective, but you may not have that card. So enroll 3 months before. Next question. What is Medicare Part A? Now, true confessions here. When I first started doing this 27 years ago, I didn't have a clue what Medicare was, what Medicare A. I could not remember for the life of me. I could not remember how to. So I literally have come to the point where I tell everybody, hospital has an A, Medicare A. That's how I remember it, Medicare A. The answer is it covers your hospital costs, anything inpatient, and up to 100 days in a skilled nursing facility. And Megan gave you lots of information, and it really is confusing. But again, it's all in the Medicare and You handbook, or I do have it on that Medicare Cost 2021 handout that you can download. Next question. You knew this was coming up. If I asked you what Medicare Part A was, hospital inpatient, what is Medicare Part B? And I bet you're all saying, answer please, doctors. It is medical insurance. Doctors, outpatient, anything outpatient. It also includes that durable medical equipment, home health and preventive services. That's Medicare Part A. Next question. How do I enroll in Medicare? Well, there are several ways. You know, we used to truck down to the Social Security office and enroll, but really that's not really how it needs to be done. You can, but they've been closed during the pandemic. The best way to enroll in Medicare is, answer, to call the Social Security Administration or apply online. And by the way, everyone really needs to have an online Social Security account. It has everything there that you need. You can apply for Medicare. You can see everything there. And it is extremely secure. In fact, it's so secure that sometimes I get a little mad at it because I have to change my password every quarter, I think, but it is very secure and you're going to need it. It also is helpful if someday you have a child who's taking care of your healthcare needs. They actually can see what are your Medicare benefits on that? What are your Social Security benefits? So it's very helpful. Next question. How much does Medicare pay? This is one of those that Medicare will pay a certain amount of the approved amount. How much? Answer, please. 80%. So let me break that down. You have a $100 doctor bill. Medicare approves 80% of that. Let's say Medicare approves $90 of that. 80% of that, Medicare will pay $72. Who pays that other $8? You do, unless you have a Medigap or an Advantage plan. So Medicare pays 80% of the approved amount, you pay 20%. Next question, please. What is a Medigap supplement? Well, that's kind of a whole head full, isn't it? It will make up for the gaps that Medicare does not pay. Answer, please. It can help pay those Part A deductibles and copays. And was your head spinning when you saw all the benefit periods and the amount of a Part A deductible? If you have a Medigap, you won't have to worry about that. That will pay for that. And for Part B coinsurances, that 20% that Medicare doesn't pay. It's called a Medigap. It used to be called supplements. The official term is a Medigap. Next question, please. How do I buy a Medigap? They are private insurance products, highly regulated by Medicare. And we saw the alphabet soup. They all are the same. A G is a G is a G, no matter what plan you buy it from. The only difference is the cost. So it pays to go to either an insurance agent or for you to do your research and get the best Medigap for you. Answer, please. You can go to a health insurance agent or as yourself, as Megan said. You can go to the website and we'll put this, it's on the resource sheet at the end of the presentation. It's wonderful. You can go to www.indoi, which is the Indiana Department of Insurance, which SHIP is under, .in.gov/Medigap. And it is a wonderful resource. I think that's it. How do I buy a Medigap? Congratulations, way to go. You made it through your first quiz. I hope you didn't have any test anxiety. And don't worry, like I said, if you didn't remember the answers, you could watch this again. It will be recorded. Or maybe you had to leave and run an errand. You can watch the end of it. It will be recorded and you can share it. Now, I want to talk about Medicare Part D. What is Medicare Part D? Well, like I told you, I had trouble remembering what a Part A and a Part B was. Part D stands for drugs. Finally, I have something I can remember. Part D drug plans. And it is coverage for prescription medications. Oh, not over the counter, not something that you purchase from India or Canada. It has to be domestic for prescription medications. Part D is voluntary, but there's a big caveat here. There's a lifetime penalty. In 2022, it's going to be about $4 a month, every month for the rest of your life, if you don't enroll when you are first eligible and you do not have other creditable coverage. In other words, if you're still working and you have creditable coverage, which means it's as good as or better than Medicare Part D, you don't have to take Part D right away. You can opt not to take it and you won't have a penalty. But if you don't take it when you're eligible, there's a lifetime penalty. You must have Medicare Part A and or B in order to enroll in a Part D plan. And like MEDIGAPS, they are sold by private Medicare approved health insurance, Part D insurance companies. And I looked it up, there are 23 plans in Indiana in 2022. Next slide, please. How does Part D work? Remember, Part D, like Medicare, is an insurance product. In 2022, the premiums for those 23 plans range from a low of $6.80 a month to a high of $92.50 a month. The annual deductibles, which are regulated by Medicare, can be anywhere from $0 a month, or annual deductible a year, to $480 deductible. So it's very easy, like any insurance plan. You pay your monthly premium, and if you have a deductible, once you meet that deductible, the plan then pays 75% and you pay 25% or less. Easy peasy. Now, I will tell you this, some Part D plans sort of jazz up their products and you may pay less than 25%. You may be able to get free generics. It depends upon the individual plans. Now, you probably have heard the term the donut hole or the gap. Well, really, those have disappeared. There is what is called an initial coverage limit now. And let me explain that to you. In 2022, once you and your plan have spent $4,430, you have reached what's called the initial coverage limit. It used to be called the donut hole because there was no coverage after that. But now there is coverage in this initial coverage limit. You pay 25% of the cost for generics and 25% for brand names. So in this coverage, when you reach this coverage limit, which is $4,433 that you and your plan have paid, you are going to pay 25% for generics and 25% for brand names. Now there is a catastrophic level that you can reach, and I didn't put that in. I think it's around 6,000, where after you reach that, you only pay 5% and your plan pays 95%. Next slide, please. So when do I enroll? At your initial enrollment period. Most folks enroll for Medicare, and as soon as they get that Medicare number, they will enroll in their Medigap and their Part D plan. You can use an insurance agent, the same one, to enroll in a Part D plan. You also can enroll in the annual enrollment period. Tomorrow, October 15th through December 7th. During that time, you can enroll or switch plans, and your coverage is effective January 1st. Now, let me tell you, I manage my parents' health care. I would get on the Medicare website and I would look and shop around plans every year. Why? Well, you saw that the low monthly premium is $6.80, and it goes all the way up to $92, and deductibles are from $0 to $480 a year. That tells you there's a lot of disparity between these, and you need to find where you fit to get the best plan. And I'll teach you how to do that. Run my parents' medications on the Medicare Plan Finder tool, and I would switch every year. Easy peasy. There's no penalty for switching. And if you always feel badly about the plan that you have, don't worry. Your new plan will disenroll you from your old plan. Now, that's a lot of information, but there's so much help available. First of all, let me tell you, you can buy your own Part D drug plan. You don't have to buy it from an insurance agent. If you feel more comfortable, or your son's an insurance agent, whatever, you can do that. But you can go on the Medicare Drug Plan Finder. It is a web tool that is phenomenal. Let me explain it. You go on Medicare.gov, and there'll be a button in the middle that says, find Part D drug plans. you hit on that, it'll ask a few questions. It'll ask your zip code. It'll ask some other questions. And if you want to hit I don't know, you can, because this is not, it's really not going to capture that kind of material, that kind of information. You can put I don't know, and it'll bring you to the page that says, what are your prescription drugs? So you have your prescription drug list, the name, the milligrams, and how often you take it. And it will ask you what those are, and you type them in. So you type in prescription A, and maybe it's 5 milligrams, and I take it once a month, which is 30 times I need 30 pills a month, is how Medicare Drug Plan Finder says. And when you have typed in all of your prescription meds, you will hit the button that says, my drug list is complete. And that plan finder will take your prescription drug list and go out to all 23 drug plans in Indiana. It'll take your list and calculate your copays, your deductibles, all the annual expenses, and it will then calculate them with your drug list individually for you and rank them or list them cheapest or lowest cost per month or annual cost all the way to the most expensive. It's very important that you do not pick a drug plan because that has the lowest monthly premium. You don't know what that medication will cost from plan to plan. The drug plan finder will do that for you. And what you want to look at is the annual cost. That includes your premiums, the copays, the cost of your medications. It is a wonderful, phenomenal tool. Like I say, I switch my parents every year. If you don't feel comfortable doing it, I bet you have a grandchild that can do it for you. You're all internet savvy, you're watching, or you can call Medicare, or you can call SHIP. Now, I'm going to give you the best free advice today. You can call the 800 Medicare number for any Medicare issue. And when you hear the automated lady, you say the word agent, and you will be transferred to a real, live, breathing person in the United States of America. And if it doesn't happen right away, I tell everyone, we'll be a little louder and a little more angry. Agent, like customer service agent, and you will be transferred to a real person. Great advice. Or you can call SHIP. That is the state health insurance program. And they have volunteers, highly trained volunteers all over the state of Indiana. And you can make an in-person appointment. Megan, are they doing in-person appointments this year? Yes. Last year they didn't during the pandemic, but you can have a sit-down appointment with a SHIP counselor. Again, they can't enroll you, but they can lead you right up to the point that you feel very confident about your decision. Now, why would you shop around? I always say the plans change every year and you change. You are only one doctor's appointment away from that $300 or $400 prescription. So every year, shop around. Next slide, please. Now, last year, there was a new plan or a new program. It was actually instituted in the Trump administration, and it was for insulin. Insulin prices had been going skyrocketing. In fact, some folks couldn't afford their insulin. There are Part D drug plans called the Part D Senior Savings Model, and you can get insulin coverage of a broad set of insulins for as little as a $35 copay per month. That's a really big deal. And you can find that on your drug plan finder. And if you find that you're not getting that, you call SHIP, and that counselor will help you to find that coverage if you are on insulin. Next slide, please. Now, we've talked about Medicare A, B. We've talked about Medicare drug plans D. We've talked about MEDIGAPS and supplements. There are two ways that you can get your Medicare coverage. You can get through original Medicare, again, that's Part A, B, and a Part D drug plan, or you can get your Medicare coverage through an Advantage plan. Now, does that word Advantage plan make your head spin and you break out in hives and you say, okay, I'm too confused? Megan is going to explain this to you, and I promise you the light bulb will go on. And it's probably, I think, one of the most important decisions is whether to have original Medicare or to take an Advantage plan. So original Medicare, next slide, please. I'll just give you the groundwork and Megan will take it away. On the red side, original Medicare. It's Part A, Part B, and Part D. Now, if you were to take those three parts, bundle them up, and give them to a private health insurance company regulated by Medicare, and they are then responsible for all of your health care expenses. Medicare's not. It's the Advantage Plan, Part C Advantage Plan. Next slide, please. The Advantage Plan is called Part C or MA, which stands for Medicare Advantage. It is privatized healthcare, and it is regulated by Medicare. Now, one of the reasons that folks like Medicare is because sometimes the monthly premium is as low as $0 per month. But there are many things you should consider. There are advantages to Advantage plans, and there are disadvantages. And Megan is now going to explain the difference of the two ways that you can have original Medicare or Medicare Advantage. So if you have original Medicare, you carry your Medicare card. If you have Advantage plan, you carry your health insurance Medicare Advantage card. So Megan, take it away.
Thank you, Jan. Next slide, please. So Jan did a great job laying the groundwork for an Advantage plan. This slide breaks down the differences between original Medicare and the Advantage plan. So we're going to look at the left slide first. We have our original Medicare. That's our A and B. You can add on your D. You can also add on the supplement, fill in those gaps. So if you were just someone who had original Medicare A and B and you had your drug coverage, what is important to know is with A and B, there is no max out-of-pocket coverage. If your 20% for the year is $50,000, that's what you will pay. If you have multiple hospital stays outside of the same benefit period, you're going to pay that $1,484 deductible multiple times. One of my counselors reached out to me yesterday. They have an individual who just had A and B. They had no supplement. They had no Advantage plan. And they had an ambulance trip from Northwest Indiana all the way down to Indy. That ambulance ride was $50,000. Their 20% was $15,000. And that is what they owe to Medicare or to the ambulance company. Medicare paid their part, you have to pay your part. So if you're someone who has a lot of health issues, you're at the doctor quite frequently, you can afford a premium with the supplement. Normally the premium for a supplement starts around $100 a month, depending on the plan that you pick. Then the supplement might be the best choice for you because you're going to fill in those gaps of the deductibles, the copays. You'll pay that monthly premium and then you really don't have any out-of-pocket costs. But what if you're someone who can't afford that premium, or you don't have health issues, or you're like my husband and you don't go to the doctor? So you may fit into an Advantage plan. So an Advantage plan, again, is with a private insurance company. It's going to bundle your A, your B, your D. It's also going to give you extra benefits. It's the only form of Medicare that will provide you vision, dental, hearing, transportation to the doctor. Some of the plans have stipends for over-the-counter drugs and for food. Some plans give you a card every month for $50 worth of groceries. And then some of them have like silver sneakers, those extra types of benefits. And that's the only, again, Medicare that offers you vision, dental, and hearing. The nice part of the Advantage plans is it has a max out of pocket. So most of them are anywhere between $4,000 and $8,000 for the year. So again, if you are someone who cannot or does not want a supplement, a Medigap, then you may very seriously want to consider bundling your insurance so you have that protection of a max out of pocket if you don't have some form of supplement So you're just not left with the bare minimum of A and B and paying a $15,000 ambulance bill. So that's kind of in a nutshell, all how those work together and kind of like the benefits of having an Advantage plan. Now, you want to be very careful before you switch from original Medicare with a Medigap to an Advantage plan. Because once you get, if you do have a Medigap and you listen to your neighbor Joe and he's telling you, oh, how great this Advantage plan is, I don't pay a premium for this and I get all these extra benefits, or you listening to Joe Namath or Joe Montana or whoever it is on the commercials, or you're looking at all the mail that you're getting and they're saying free, 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 all these extra benefits, that's great. But they're there to dangle those carrots in front of you. You want to know all of the details before you make a switch, because if you leave your Medigap, you may have difficulty getting back to the Medigap. The Medigap has very specific enrollment rules on when you can, looking at pre-existing conditions, all of that fun stuff that you can certainly call a SHIP counselor about. We didn't get into those details today. If we told you everything about Medicare, we'd be here till midnight. So we're talking about the important pieces. So you want to make sure you know all of those details before you make a switch. Next slide, please. So another thing to keep in mind that's important to know is with original Medicare, and that includes the Medigap plan as your supplement, you can go to any doctor or hospital that takes Medicare in the United States. As long as that doctor takes Medicare, then they're going to accept your Medigap company, no matter who that insurance carrier is. You also don't need a referral to see a specialist with original Medicare and a Medigap. With an Advantage plan, it's a little bit different. They have networks. So there's an HMO and a PPO. And with an HMO, you are going to have a very small network, and those are only in network. With a PPO, you might have a bigger network. You can go to in network or out network. Before you switch to an Advantage plan or another Advantage plan, you want to make sure that your doctors and your hospitals are in network before you make a change, or you may not be able to get out of it and you'll have to wait until another enrollment period. If you're someone that travels, if you're snowbirds, you want to make sure that where you go throughout the year has some options for you. That's very important. So make sure before you make a switch that you're looking at all of the details. You're not just looking at all of the free stuff or the carrots they're dangling in front of you. They're great things. Advantage plans can offer great coverage for you, but you want to make sure that it's great for you. So Jan, I think it's time for the second quiz.
Yes, it is, everyone. I imagine, again, you're thinking, wow, I think I'm starting to get it, but let's review. Let's do the quiz. First of all, what is Medicare Part D? Easy. I know you all have it. It's coverage for prescription drugs, D for drugs, and not those you buy overseas and not over the counter. Next question. How do I buy a Medicare Part D? Well, can I get it at the big box store? No. Can I call Social Security? No. The answer is you buy it from an insurance agent, or you can shop and buy yourself, as I explained on the Medicare Drug Plan Compare tool on the www.medicare.gov. And that's the same tool that a SHIP counselor will use. Many times pharmacists, insurance agents use it. So have your if you go to a SHIP agent, you'll want to have your prescriptions with you, the milligrams and how often you take them. Make sure you take your drug list with you if you make an appointment with a SHIP counselor. Next question. What is an Advantage plan? By now, I hope that you're thinking, answer, please. it combines or bundles Medicare Parts A, B, and D. And it is given to a private health insurance company. It's sold by private health insurance companies. It is privatized Medicare. It's not traditional government-run Medicare. It is regulated, highly regulated by Medicare, but it's private health insurance companies. And as Megan said, there are networks and things you have to be aware of, PPOs, HMO, all of those kind of things that you want to be aware of. So you're like, I'm still confused. So let me try to wrap it up here a little bit. I'm going to give you my thoughts because I can do that. Original Medicare. It costs more per month. Megan talked about that. Usually they're around $100. So I think it's a real surprise when I talk with Medicare beneficiaries. You do have to pay everyone, whether you're on original Medicare or Advantage, the $148.50 for your Part B. Then you will pay for a Medigap if that's the way you want to go through original Medicare. And it could be when you start 100 to 120 a month. Then you get a Part D drug plan. And I think that's pretty shocking for some folks. They didn't realize that that's what they need to do. But believe me, it's probably some of the most comprehensive healthcare you can have. Here's why the Medigap is I think, the advantages of Medigap. You can go to any doctor, anytime, anywhere in the US that accepts Medicare. When my dad, he passed away when he was 96, but when he was in his 90s after mom died, sometimes my sister and I joke, we think he went to the doctor just because he was lonely and he had a Medigap, he could do that. There are no copays, no coinsurance, no surprises with the Medigap. Let me tell you this. When my parents enrolled in their Medigap, I have no clue. They were 65. I have no clue. I was probably off in college. I don't know what their monthly cost was, but I do know by the time Dad was 95 and 96, his Medigap that he continued to maintain for all those years was $330 a month. They do go up each year incrementally based on your age or where you live. But that probably took your breath away. $330 a month. But let me assure you, my father was probably in the hospital in the last 3 years of his life 5 times. He was in rehab 3 times. And one of those rehabs, he almost used up his whole 100 days of rehab. And he never saw a bill. He surely had to incur hundreds and hundreds and hundreds and hundreds of thousands of dollars in medical bills. But he had that Medigap, and I'm going to tell you about $330 a month was nothing compared to what he racked up in healthcare costs in his last few years of life. Medigaps are great. You don't have to have a referral for a specialist. Now, this is something Megan mentioned, but I think we need to re-emphasize it. Did you know that if you're on a cruise ship and you slip and fall by the pool and break your ankle, and you've gone over the international the boundaries, Medicare will not pay for expenses incurred outside the boundaries of the United States. Some Medigap plans will pick that up. My husband and I went up to Canada several years ago. We went to Jasper and Lake Louise, and he woke up one day with a excruciating, well, it was sciatica, pain down the leg. We went to a Canadian hospital, and Medicare would not pay for that. But we knew that we had a Medigap that would pay for it. So it is very important if you travel a lot, or if you're a snowbird. Remember, those HMOs and networks don't travel to Florida. They're in Indiana. So there are over 55, I looked this up, Megan, 55 Medigaps in most counties, 55 in St. Joe County. I took our largest county and did that. Now, what about Advantage? Medicare Advantage plans, they cost less per month. Like Megan said, the carrot on the stick of that 0 premium per month. But remember, it is managed care. They manage your care, these insurance companies. There are networks and service areas. There are copays and coinsurances for separate services. Most cases, you have to have a referral for a specialist. Now, I always like to give this example. When my dad was 95, he had his Part A, Part B, Part D, and a Medigap, and he went to rehab. He could go to any doctor anytime for any reason, and he never saw a bill. No problem, right? Well, my brother, on the other hand, is 74 years old. He's very healthy. He's on a national softball team. He lives close to a hospital that has its own Advantage plan. So all of his doctors are in network, so he doesn't have a lot of those co-insurances. And he thinks it's great because he doesn't hardly ever go to a doctor. It's $0 per month. But what would happen if my brother went on a cruise and he was going down the step and a little boy ran in front of him, he tripped and fell and he broke his leg? His Advantage plan is not going to pay for his transport if he's outside of the international boundaries. He may end up having to pay full for that transport to get to a hospital. When he gets to a hospital, let's say they fly him back to the United States, he's going to have, because he's probably out of network, even though it's emergency services, he could have copays on his x-rays, on the doctor, on the hospital. He kept all kinds of copays. Now, as Megan mentioned, I did look this up, Megan, on Advantage plans in Indiana, the highest out-of-pocket that you could have in a year with an Advantage plan is $7,550. So most folks take the Advantage plan because it has 0 premium. But remember, can you afford that if you have a bad year? Do you travel and you can't stay in those networks? And are you willing to make sure that you have referrals for specialists and you understand that you're going to have some copays? That's what you need to decide. You need to find out what's best for you. There are 133 Advantage plans in Indiana in 2022. Now, having said that, there are over 33 million Advantage plan beneficiaries, and they're very happy with their Advantage plan. So they'll say, well, what should I get? Well, what's best for you? And again, that's why we are here today. So next slide, please. We're going to take some questions, and I'm going to bring Jacqueline Ridenauer, who's on our staff, and she's going to do some of these questions for us. And as a reminder, the handouts that I've mentioned, my Medicare 2021 costs, my what we got from page 76 on the handbook of the Medigap plans. I have a 1-page synopsis of Part D plans that I update every year. And the next slide is going to have all the contact information. I put it on a Word document so you can download all those emails, phone numbers that you need. So we're going to bring Jacqueline in, and Jacqueline is going to ask the questions that we've had coming in, and Megan is going to answer them. Jacqueline?
Thank you, Jan. Hello, everyone. Our first question is from Nancy, and she asks, how do I find local, unbiased Medigap insurance agents?
Good question, Nancy. And I talked about this a little bit. Honestly, an insurance agent and insurance broker is not going to be unbiased. They will be biased because they are working with an insurance company or multiple insurance companies. The only unbiased source out there is CHIP counselors. So you can give us a call and we would be happy to assist you with your insurance questions.
All right, the second question is from Barbara, and she says, my husband and I are going to continue working past 65. I know that we have to prove that we have other insurance by the time we retire and choose Medicare. So will we still need to sign up for the free Medicare, or can we wait on that also?
That is a good question. So that's going to be a personal decision. Now, you can go ahead and take your Part A because essentially it's a free premium and you've already got it. You're kind of already locked into Medicare, and you can delay your B as long as you've got that creditable insurance. Most people do go ahead and take their Part A, even though they're still working. But if you just want to decline both A and B, you can certainly do that as well.
All right, and the third question is from Debbie, and she asks, should we buy a supplement for Part A?
Again, that's going to be a personal preference. It would be Part A and Part B that you're buying a supplement for. You can't buy one for just A and one for just B. So normally we say our usual candidates for a Medigap is someone that doesn't mind paying that higher premium, someone who wants to pay your premium and then have fewer out-of-pocket costs. If you've got medical issues, if you're in the hospital, you're seeing multiple doctors, maybe there's a family history of cancer or dementia or strokes. As you get older, you may be an unusual candidate for a Medigap. But if you're someone that really doesn't want to go to the doctor, you don't want to pay that premium for a Medigap, you don't have health issues, then you'd be a usual candidate for an Advantage plan.
Okay, and then for the fourth question, Rebecca says, my spouse turns 65 next week. What is his enrollment deadline for Medicare? And is the level of his benefits contingent upon the date of his enrollment?
Good question. So if he does not get Social Security income and he's turning 65 next week, you need to log off this webinar as quickly as possible. Jan's shaking her head and agreeing with me, and you need to call Social Security. Now, when you're turning 65, you have a 7-month enrollment period. So 3 months before, the month of, and 3 months after. But if you want that Medicare to start on the first of his birth month, then ideally you should have been calling 3 months before. So make sure you're calling Social Security as soon as possible if you have not already. Now, Jacqueline, what was the second part of that question?
Second part was, what is, is the level of his benefits contingent upon the date of his enrollment?
No, that's more of like a Social Security income kind of thing, but not with Medicare. The only thing that would be at play by delaying the enrollment is when it's going to start and potential penalties.
Okay, and then the fifth question, and I kind of went over this, but it's from Margaret. She says, what is the difference between Medigap, Medicare Supplement, and Medicare Advantage? How do you decide which type of coverage, especially if you have to use specialists frequently?
Your key word there is frequently. If you're seeing specialists frequently, doctors frequently, then that's going to kind of tell me that you would probably fall in the Medigap category of it being beneficial to you. So, the Medigap is going to fill in those gaps of A and B. So you pay that higher premium up front, kind of like a savings account, I like to look at it as, and then you don't have out-of-pocket expenses. Your deductible for Part A is paid, your co-insurance, deductibles, co-insurance, co-pays, you just have to pay that Part B deductible unless you can get a C or F. And then an Advantage plan is going to be kind of opposite. You don't have a monthly premium, but you have out-of-pocket costs. So that's one way to look at it. How do you want to pay for your medical bills? Some people, I say, sit down and look at what you did last year. How often did you go to the doctor? How often were you in the hospital? How many tests did you have? What kind of tests did you have? And kind of calculate the costs there, co-pays and whatnot. And then you can multiply that, or you can multiply a possible premium for a Medigap of $100 a month by 12 months. And then looking at that max out of pocket for an Advantage plan. What is going to be most cost effective for you?
All right, we have a few more questions. This one is from Teresa from Star City. She says, I have been on Medicare for a couple of years because of disability. Now about to transition to retirement. Will everything automatically switch over, or is there action I need to take?
That is a great question. Thank you for asking that one. Nope, everything will be automatic. You do not need to do anything. If you want to review your plans during open enrollment, that's great. We can get you switched if there's a better plan. But just because you're moving from disability Medicare to retirement Medicare, you don't have to call Social Security. You don't have to re-enroll in plans. You are good to go.
All right, and then Linda asks, she says, for anyone under 55, we can only get Medicare if there is a medical condition, correct?
You have to be on disability if you're under the age of 65. If you are getting Social Security disability income for 24 months, then at your 25th month, you can have Medicare at any age.
Okay. And then do Medigap plans include dental, or is that another plan to add on?
No, the only form of Medicare that offers vision, dental, and hearing are Advantage plans. So if you're someone that wants original Medicare A and B and you want to get a supplement Medigap, you may want to look at standalone non-Medicare vision, dental, and hearing plans.
Okay. And I think we have one more question. How high do Medigap plans go for premiums?
That's a good question too. And that's going to depend on so many factors. So don't freak out when you hear the answer. It's going to depend on where you live, if you're male, female, if you smoke or not, if you and your spouse have a plan together, and how long you've been on it. So generally, when you're turning 65, they're going to start off around 100, a little bit less, a little bit more, depending on which of the plans you pick. And then if you're still on a Medigap, when you turn 90 or in your 90s or late 80s, it could be around $400, $500 a month.
All right. Well, I think that's all the questions we have today. So Jan, I'll turn it over back to you.
Thank you, Jacqueline. As I said, Megan, my dad passed away, I think in 2016. His was $330 a month. So yes, but remember, I think the percentage is very high. The amount of healthcare expenses you incur in the last 2 or 3 years of your life is like, that's the majority that you'll ever incur. So even though they're higher, that's why they are higher. You're going to incur a lot of Medicare expenses if you're 90 or 93, like my father did. Also, a couple of things that I wanted to add to that. Those increases for Medigaps and Advantage plans all are highly regulated by Medicare and the Indiana Department of Insurance. They just can't just jack up prices willy-nilly. Those have to be submitted to the Indiana Department of Insurance. The price increases for Medigaps and Advantage plans, and I'm sorry, for Medigaps, and they have to be approved. So they go through a rigorous screening, all Medigap plans providers. Another thing I wanted to mention to you, it's pretty interesting. If you were just to Google in a Google box Medicare, you'd be surprised how many things come up that are not official Medicare. Most of them are marketing. So always look for something that ends with .gov, G-O-V, Medicare.gov, SSA.gov, ship.in.gov. Those are the official websites. And boy, you can get sucked into some of those other websites and be buying something before you even know what happens. Is that right, Megan? Very true. Okay.
It is, yes.
If you have further questions, please feel free. Megan has been very generous to share her email address and her phone number there. You can email her or call her, or you can email or call me at Jackie Walorski's office. And if you don't have a printer and you can't print off these handouts, like this one is that slide that you're seeing right now, I have it, you can download it. Please feel free to call me, leave a message if I'm not there, and I'll print them and mail them to you, no problem. Now, I think that's, if you have any other questions, again, you can always contact Megan or contact me. And I wanted to add, if you're curious why a congressional office would want to do a Medicare 101, it's because we represent you to the federal government in all federal agencies. Jackie has staff people that are highly trained in immigration, visas, Veterans Administration, and the IRS, which is a big issue right now. We can help you if you're beating your head against the wall. Stop and give a call to our office, and we can help you with any federal agency, Social Security, Medicare, whatever it is. And our staff will quickly respond to you and assist you. So, and one thing, Megan, we did forget, we didn't get to that question, was about Veterans Administration. Could you speak? The question usually is asked, and if you could speak to this, if I have VA, do I need Medicare? This is a big question.
It is. Thank you for bringing that up, Jan. that's going to be a maybe. It's going to depend on different factors. That's when you need to get advice from a SHIP counselor or another trusted source, because it's going to depend if you're getting VA benefits or you have TRICARE for life. There's two different types of VA benefits you could get. And then if you've just got the regular VA health benefits, it's going to depend if you have outside VA doctors and you need medicine from outside VA pharmacies. If you're just with the VA and you're confident that you'll be with the VA for the rest of your life and no other sources, then you could just stick with the VA. But to protect yourself, you probably are going to want to get your A and your B and your drug coverage to avoid penalties.
Megan, my parents were both World War II veterans, and they had Medicare A and B and D and a Medigap and VA.
Good.
They had great because there were just too many times that VA, if there was an emergency or, that VA would not cover unless they were not close to a CBOC, a VA healthcare center. So anyway, thank you for joining us today. Remember, education on Medicare is empowerment. We want you to make the best decisions for you. Call SHIP, and as you can see, there is a wealth of information and resources available. They're right here, and sadly, people don't know they're there, and they don't utilize them. So we hope that this has been beneficial to you. We hope you've enjoyed it, and that maybe some light bulbs are coming on as far as Medicare and